Hi, everybody. Welcome to Nursing 423. This is your global health course. Today's class is on the introductory material. We'll talk about terms and key concepts and how it all happens. So, first, we're going to talk about person-centered language. A lot of the language we use in healthcare actually marginalizes and stigmatizes the people we say we want to help. So, when we say things like the poor, we're defining a group of people by an economic status. Instead, it's more accurate and more sensitive to say people experiencing poverty or a person experiencing poverty, put the person first and their condition second. Noncompliance, probably the worst one of all of them. Noncompliant has this connotation that we, the providers, know best, and it is our job to tell people what to do, and it is their job to do what we tell them. That is not the relationship that we're trying to cultivate in healthcare. It should be a partnership. Also, the word non-compliant has a stigma all of its own. And most people conjure up an image of a patient who doesn't care about their health, maybe is lazy, maybe isn't intelligent enough to understand directions, or just willfully, deliberately refuses to do what we know is good for them. The word that I would like you to replace non-compliant with is non-adherent. Non-adherent describes a behavior. This patient is not adhering to their treatment plan. And maybe there's a good reason for that. Maybe they can't access it. Maybe there's a financial barrier. Or maybe it conflicts with some other important priority. They don't have childcare to get to office visits. Or maybe the treatment plan just doesn't work for them. It has side effects that they can't tolerate. So if we're adopting a partnership model and we're putting people first, let's describe the behavior as non-adherent and not describe the patient as non-compliant. Vulnerable populations is a tricky one. You will probably hear this frequently by very well-intentioned people who have every intention of helping. But what it does is it stigmatizes a group of people by saying that somehow they are inherently fragile and at higher risk because of some characteristic of that group of people. Instead, it's more accurate to think of a population as people at higher risk for a healthcare problem or people at higher risk for healthcare disparity. It's a little more accurate to say, and again, it does not, label a group of people or person with some undesirable stigmatizing language. Drug user, alcoholic, smoker, any other behavior you can think of. If we're using an undesirable health behavior to describe a human being, we are stigmatizing them, and that does have negative impact on their health outcomes. If folks feel that they can't go to a provider without being judged or being called an addict or drunk, they're not going to have good health outcomes. Again, we're partnering with people, and it is our job. The ANA Code of Ethics states very explicitly that we are to treat every human being with dignity, regardless of the reason they're seeking care or a health behavior that might contribute to it. So instead, you're going to use a term like a person experiencing a substance use disorder, a person who has a substance use disorder, a person with alcohol use disorder, even just a person who uses drugs or a person who smokes. That puts the person first and their behavior second. We know we have to address the behavior, but it should be a partnership, and we should not be using it to demean or humiliate another human being. So that's person-centered language in this course. In your posts, in your written work, I would like you to use the person-centered language. There is a link here. I would like you to click on it, take a read at it. I'll put it in the module. All right, so let's get to work. Let's define what global health is. Everybody sort of has an idea of what global health is. They might think it's like public health, which it is. It's like community health. It's just bigger. It's about a lot of countries. Maybe they get images in their head of, people going to Africa and doing mission work. But we really need an operationalized definition. And so Copland in 2009 published in The Lancet his definition. Now, his definition is pretty wordy. And I don't know about you, but I'm a clinical person. I can read all day about signs and symptoms and risk factors and interventions and goals and all that stuff and understand it perfectly fine. But when I read a very long paragraph of very abstract information, it sometimes takes me 3 or 4 read-throughs before I go, oh, that's what it is. So what I've done here is I've broken it down, and then I'll discuss each component of each statement, so you have a clearer picture of what global health is, what framework you should be operating from when you think about global health. So here's Copland's definition. First statement: global health is an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So now we need to know what is improving health and how do we achieve equity. Improving health, and we're going to use the World Health Organization's definition of health, which encompasses, the physical, mental, and social well-being, to achieve the highest potential. You do need to pay attention to social aspects and mental health, if you are going to achieve better physical health on a global level. These things are important determinants of physical health. We have like sort of an emphasis on this country. We don't like to talk about mental health, and we don't like to address social inequalities. We think about health, we think about the doctor with the stethoscope or a nurse with a needle in her hand giving a vaccine. But we need to address those other components if we're going to help people achieve their best health. Equal emphasis on prevention and treatment. Again, most people think of going to the doctor when they're sick. We need to change that. We put a lot of money in this country into sustaining life at the last, week or 2 weeks of life in the ICU, and not really a lot of money at all on preventing the conditions that put them in the ICU in the first place. Prevention not only extends life, it enhances its quality. Um, you in community are going to talk about ACEs, adverse childhood experiences, and their impact on health. You'll talk about the influence of weathering on people. So prevention doesn't just mean talk to people about healthy diet. It means, these mental and social components. It means giving access to all kinds of conditions. So let's move on to the next thing, which is achieving equity. Equity is not the same as equality. You may have heard that or you may not have. I will make that very, very clear. Equity means that everyone should have an opportunity to live a safe and healthy life. It should be a basic human right that is protected for all people. It is not a privilege. It is not something you earn. It is a right for every human citizen on this planet. However, in reality, we know that there are big differences across communities, across nations, across the globe, in the environments where we live and grow and work, social status, and access to resources that support health, not just access to healthcare providers, but clean water, clean air, transportation. Um, those things are really important, and yet not everyone has them equally. So, achieving equity and justice in health means eliminating these disparities, these differences, and distributing resources where they are most needed. So, here's a little graphic to sort of make that concept a little more visual. Reality is that some people get a lot more than they need. Other people don't get enough. Some people are at a big disadvantage. They're not just not standing on a box, they're standing in a hole. They start out very disadvantaged by the system. Other people, like I said, the person on all the way to the left is standing on 7 boxes. He has much more support than he needs just to see that baseball game from behind a fence. In the second picture, we have equality, and this is an assumption that everyone benefits equally if they're given equal treatment, if they're given the same support. So here, everyone gets a box. Everyone has the same supports, but the tall person really doesn't need the box. He can see in front of the fence to see the baseball game. The second person in the red shirt has to stand on his toes and kind of pull himself up a little on the fence, but he can see the game because he has a little extra. The third person gets the extra box, but it's not doing any good because he still has the fence in his way, cannot see the game. So let's talk about how equity is different. Let's redistribute those same 3 boxes. The taller person doesn't need the box. Give it to the shortest person. Now he has 2 boxes and he can see the game. The second person gets 1 box. That's enough. He can see the game. Everybody gets to see the game. That's equity. people get supports and accommodations to help them do what they need to do. Justice is even better than equity. This means we don't need supports or accommodation because the fence is gone. The barrier was removed. The cause of the inequity was addressed. Justice is our ultimate goal, but we should at least be striving towards equity so that people can access that basic human right. Okay, last part of, the definition is global health. Oh, it's not the last part, sorry. Global health emphasizes transnational health issues, determinants, and solutions. So that defines it as separate from, say, community health. These issues are transnational. Some of the examples are communicable diseases. We were all around 3 years ago for the pandemic when it started. And at first it was in China, and we thought it was a Chinese problem and it wasn't going to come here. Well, guess what? That virus didn't know boundaries, borders, homeland security. It just came right over and it took over the world and created problems that we're still dealing with today. Climate change is another example of a transnational issue. It does not just affect people in South America. It affects people all over the globe. Pollution, again, it crosses borders. Displacement from war, famine, and natural disasters. So this happens, it can happen locally in one place, but as people migrate so that they can survive these, conditions, they bring their health issues with them, and that impacts public health in the nations where they find a home. So last part of the definition, this time it is the last part, I promise. It involves many disciplines within and beyond the health sciences and promotes interdisciplinary collaboration. Well, I told you it was a lengthy definition, and I wasn't lying. But what does that mean? How many disciplines do we need? Global health deals with multiple issues that are extremely complex. And understanding the determinants of global health problems, finding solutions that actually work in the systems that we've developed, requires a lot of thinking from many, many different disciplines. Everybody has to bring their perspective to the table. So we need teams of experts in culture so that we understand populations that we're serving. We need experts in finance so that we know how to allocate resources fairly, equitably, not equally, equitably, and where to find that money, how to redistribute, where can we take to make sure we have what we need. Public policy is very important. Public policy in the United States, probably became a little bit familiar with that if you took the class 415, Nursing 415, or some other seminar class that discussed public policy. But it's very important to have regulations, laws that benefit public health. Environment and infrastructure is extremely important. People can't access good health if their environment is polluted or if they don't have the infrastructure to refrigerate medications or to get to a healthcare provider. If we don't have the infrastructure, we can't provide health to all people. Technology, very important. Technology has, connected us all through the internet, and it's a good way to collaborate. But we need those folks who can create sustainable technology that's can be used in nations that have lower resources. And we need experts in healthcare, of course. I mean, that goes without saying, and that should include all disciplines. When we talk about some limitations of the World Health Organization, you are going to learn that they're a little physician heavy, and that has impact on global health. So we need to incorporate all disciplines, and we also need to understand traditional medicine in countries that have indigenous providers, and we need to incorporate those perspectives into our planning and our interventions. Okay, and what does it mean to build partnerships? What kind of partnerships do we need? Well, obviously, no one sector, discipline, or nation can tackle a project this big. It takes many, many, many alliances or partnerships of people working together, because exchanging knowledge and capabilities is the smartest and most efficient way to find real solutions. If we leave every nation on its own to find a solution to its own health problems, every community, every state is on its own to find solutions, really aren't taking advantage of the globalization of our world, of the way that we can collaborate with one another. Okay, the last part of this definition is it's a synthesis of population based prevention with individual level clinical care. From the boardroom to boots on the ground. So, when you're addressing multiple complex problems, you need those people who can paint in broad strokes. They chart the course, they make the goals, and they give us an overarching pathway to follow to get to the goal of health and equity for everyone. But then you need people in the middle: planners, coordinators, administrators, experts, experts in healthcare, experts in architecture and infrastructure, all those people we talked about. And they're going to design programs that address the goals that people need to achieve health. And then finally, we need boots on the ground people like you, those providers who are offering healthcare to the individuals in their communities, in all parts of the world. So that's the last part of Copland's definition. And we're going to stop here and pick up with key players who are the actors on the stage, so to speak. All right.